The thoracic spine consists of 12 thoracic vertebrae. They are distinguished by the presence of costal facets on the lateral surface of the vertebral body and on their transverse processes. The costal facets are necessary for articulation with the ribs and the formation of the thorax. Also, a typical feature of the thoracic vertebrae is the long spinal processes overlapping in a tiled pattern.
Watch more videos in the EasyAnatomy app. With EasyAnatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download EasyAnatomy from the link in the description.
The general structure of the thoracic vertebrae is similar to the typical structure of the vertebrae. They have the vertebral body, the vertebral arch, which contain the pedicle of the vertebral arch and the lamina of the vertebral arch. The vertebral arch limits the boundaries of the vertebral foramen. The spinous process extends posteriorly and the transverse processes extend laterally from the arch. There are the costal facets of the transverse processes on them. On the lateral surfaces of the vertebral body, the superior costal facets and the inferior costal facets are distinguished. The superior articular process and the inferior articular process with their articular surfaces extend upward and downward respectively. On the side, we see the typical structures, the superior vertebral notch and the inferior vertebral notch. Let's look at the features of the costal facets on separate vertebrae, in order to understand how the ribs are attached to the different vertebrae. The first thoracic vertebra has a superior costal facet for the first rib and an inferior costal facet for the second rib. Vertebrae from the second to the ninth have the same structure. So, when the upper and lower vertebrae join, the superior and inferior facets form one big costal facet for the particular rib. The 10th vertebra has only one costal facet for the 10th rib. The 11th and 12th vertebrae have the same structure, except for the fact that they are more similar to the lumbar vertebrae, so they have more massive bodies, accessory processes, and the mastoid process.